Well, great day, everyone, and welcome to Spirit and Mind, where we discuss faith and mental health perspectives on current affairs. I'm Guy Robinson, Bishop Guy Robinson, and I am so grateful that you are here with us today. Please let someone know that we are on. Please feel free to share. We so love the engagement, and good afternoon to Mama Laverne Jones and to Sister Angela Pinkney and Minister Mia Rhodes and Catherine Jones and others who are watching us today. Of course, you are a part of Spirit and Mind, and we so look forward to spending this time with you. And Dr. Jonathan Shepard is with us as always. Dr. Shepard, great day to you, sir.
Yes, good day to you also, Bishop. It's good to be alive another day to say that God has blessed us and touched us with his, as they say, finger of mercy, finger of love. And so just another day that the Lord has kept us. It's good to be here. The sun is shining, having beautiful weather out here in the Mid-Atlantic region. This is a good day. Yes, sir. Yes, sir.
Absolutely, absolutely. We're grateful, and we're going to be announcing some expansions and some other venues. But we look forward to staying in touch, and we're grateful for what God is doing with Spirit and Mind. Would you continue to let people know that we are here, really serving, because we consider this an act of ministry and extension of that, just to kind of encourage and empower people of God. So good afternoon, children of God. Good afternoon. Thank you for joining us today. And today we've been talking about turbulent triumphs. We started that last week, and oh my goodness, when we were Dr. Shepard and I were collaborating on this idea. We kind of iron sharpens iron, and turbulent triumphs came to him, and it just kind of quickened with me as well, because some victories come easy and some victories come through turbulent journeys. And but either way, we have the hope of victory. But last week we talked about some turbulent triumphs, and there certainly are some in our present day context and in this past week. And we normally start, Dr. Shepard gives us some updates on, of course, the COVID-19 pandemic and medical community perspectives. And he and I were talking about that earlier this week. And so, Dr. Shepard, what updates? How are we looking?
Well, I would hope that I would have better news for how we're looking. Unfortunately, things remain in a crisis state, an emergency state. Public health emergency has not ceased. And so in the state of Maryland, and I'll just use specifically since that's where we're located right now, that things have moved to a phase 3, according to the governor. He has allowed for some businesses, more businesses to open at certain capacity levels because the transmission rate, the positivity rate, I should say, has remained below 5% for 2 weeks or more, consecutive weeks, I should say. And so that's been a good thing. However, if you have been listening to the news over the last 48 hours within the state of Maryland, we've had double the number of cases. We had dropped down to 300 and so a day. Now we are back up to almost 700 cases a day. So that lets me know that we are still in flux. Also, let me tell you, some disturbing news, as I highlighted in some of my social media posts, even this past week. The New York Times has mentioned that if we had done our due diligence, and I say we, the administrations, those who are in power, had allowed for certain things to remain in place, shutdowns, other precautionary and preventive measures, we could have saved 145,000 people versus the 100 and out of the 183,000 people that died. So if you do your calculation, I'm a man of numbers, I like math, that's 80% of the deaths that we have seen due to the coronavirus could have been prevented. 80%. Wow. 80%. I mean, that is a huge number. If you get 80% on the test, that's still a B. So let me tell you, we flipped that around. We failed. United States, we failed. I cannot emphasize that enough. And I'm sorry to say it. I don't say that with any type of placing blame necessarily on one person. We failed. We have to do better. And I'm part of that medical community that we have to do better. I know there's mixed messaging going out. CDC is even sending out some mixed messaging. And I've been from the beginning stating that we need to follow CDC guidelines. But even now, the last couple of weeks, I'm questioning even their authority, the people who are running it, because they're doing some things that don't make sense. They're doing some things such as saying that people who are asymptomatic don't need to be tested. That's ludicrous. Scientific data, the scientists will let you know that does not make sense. And thankfully, many of the big states, Texas, Florida, California, they're not following those guidelines because that doesn't even add up. Lets me know that there are other people in control trying to influence how things are being carried out. And so you asked what's the current state, Bishop? We're still in dire need. This is still crisis mode for us, and I want you all to be aware of that. All right.
Still turbulent. Yeah, wow.
Still turbulent. Yes, sir.
Okay.
Up, down.
Yes, yeah. And you said something that registered, and I know this is usually just our opening update, but you've already touched the nerve with saying the term mixed messaging. And I certainly can that certainly registers with me because even now, as you said, there's maybe the turbulence between scientific observations, and you hinted at some political influences that may be affecting the policy decision making. So that's kind of one area of turbulence. And then in terms of the collective, American psyche, if you will, there's movie theaters are opening this weekend. In fact, CNBC is reporting a spike in shareholding advantages from one of the movie theater national chains announcing that 70% of its theaters will be open across the country. Resulting in a spike in the shareholding status. So these things kind of lean towards, even right here in Maryland, as you said, where we are, we're in stage 3 now, and businesses are open. Now they're open with half capacity and still social distancing. But what I hear you saying is that we should still be very much mindful. It's sort of to stay with our theme. When you're in flight and the captain sees some stuff on the radar that we might not see, and we want to take the seatbelt off, but the captain says no, it's a little smoother right now, but I see some stuff that you still want to stay in your seats, and sometimes that's hard to do. And that's the imagery that I'm getting with the turbulence from your medical community report.
Absolutely. We got to keep those seatbelts on. One of the famed, now she's becoming even more noted, I should say, physicians, Dr. Lena Winn, who used to be the Baltimore City Health Commissioner. She said, just because something is open doesn't mean you go in. All right. So you have to take that into consideration. Just because they open the doors doesn't mean you have to walk through them. And if you decide to walk through them, you need to walk through with caution. And so we have to know that we have to remain vigilant. These things that are occurring now in our lives should hopefully have taught us a lesson that when we are now going into public places and even around family members, let me stop there and say that, because what they're saying is that a lot of the people are contracting the virus while in family, quote unquote, family gatherings. And they haven't been able to necessarily define what a family gathering is. But family gatherings have been the number one place where the virus is being transmitted. So what does that say? This is Labor Day weekend. I was in a public location yesterday. And, one of the people there were talking about, man, I got this barbecue. It's going to be on and we're going to get it in. And I mean, and I'm thinking to myself, man, this is a setup for the coronavirus. Now, granted, they may be outside. I don't know. I don't know the whole setup. I knew I wasn't going, so I wasn't about to ask a whole lot of questions. But what I am saying is that we during this weekend, especially with the weather being nice out here, I don't know where the weather is wherever you might be, recognizing that we have more viewers than who live just here in Maryland. But we want to make sure that you are being careful while you are out there. The Surgeon General yesterday gave 3 W's. And so I'm going to actually utilize that. And wherever I'm speaking this weekend, I want to talk about that. As you hold up 3 fingers, it actually can look like a W. All right. So wash your hands. All right. Watch your distance and wear your mask. So those are the 3 W's. Those are things you want to do this weekend and moving on. And let me tell you, after the last 2 major holidays we had, Memorial Day and 4th of July, we saw peaks. All right. That's why we saw that great peak toward the end of July. That's why we saw that peak in June after those holidays. And let me tell you, if we see another peak at the end of September, beginning of October, it lets me know that somewhere along the line, we're not ready. And again, it's a mindset thing, truthfully. We have to continue to be mindful. Actually, now I'm hearing the scripture now, where the word of God talks about we have to be vigilant and be watchful, for the devil as a roaring lion seeketh out who he may devour. And so I just heard that word, and so thank God for even the word of God that tells us that we have to be watchful and vigilant for those little devices that could trip us up and end up causing greater harm than good.
Yes. Watch, wear. What good timely advice. And what I see happening is, and then we'll move to our next turbulent subject matter. But what I see happening is a shift from in thinking that has to happen from a mindset of compliance with absolute state, orders, if you will. Everything's closed, to now the gradual giving of personal responsibility. I'm thinking of that when you mentioned Dr. Winn comments about just because it's open doesn't mean you're compelled to go in. So that's a statement of personal responsibility that now, the state isn't making us do these things. Now you have to take on some more sense of personal responsibility, and that's something we have to keep at the forefront. And so I just found that to be important to note that that's where we're going. Seems to be, and whether we agree or not, that seems to be where the state policy is going, in terms of saying it's more in your hands now. You got to look out for you. And that's so important, particularly in those communities that have been shown to have disproportionate mortality rates and pre-existing conditions, that we adopt the importance of that personal responsibility. So that's kind of what I hear there, Dr. Shepard.
Absolutely. Personal responsibility. You got to look out for yourself, and then look out for your fellow brethren and fellow sister. All right. We are human beings, and so we are not created to be an island. We were never created to be isolated. So make sure that you're looking out when you go to that movie theater. I know y'all want to go see that movie. Was Tenet. Tenet is one of the new movies that's out right now, and some of these others. I think Mulan. I think that's on Disney Plus. I'm surprised the theaters actually are getting back into the swing of things, because during this pandemic, what started to soar was those streaming platforms. Hulu, Disney Plus came out. Universal came out with their own platform too. So it's going to be interesting to see how these industries bounce back But just because you're in a movie theater, all right, typically you like to be around other people in the movies to see their reactions, feel their reactions. That's not going to happen. All right. So if you're going to go to the movies, just make sure that you do those 3 W's. All right.
Good. That was our extended update, which was probably necessary because, again, this is a holiday weekend, and more and more emphasis in terms of policy making is being put on personal responsibility. So we want each and every one of you, even as we endeavor to do the same, to take care of ourselves. We want you to be the healthiest version of yourself that God destined and designed you to be. So there's still some turbulence in the COVID-19 situation. So that's one. Now, the other issue that is turbulent in these days has to do with social unrest. Even as we are meeting today, protests continue in cities like Portland and Wisconsin, in the state of Wisconsin, and now in Rochester, New York. From an event that actually happened in March, but is now coming out. And so there's been several nights now of protests in Rochester against the death of, in reaction to the death of Daniel Prude. And there's a mental health component here that is significant, Dr. Shepard. And so we wanted to talk a little bit about mental health and law enforcement and engaging mental health crises. I'll give this introduction a little bit. Michael Foucault, the famed sociologist and academician, his book, Civilization and Madness, he gives a history of humans not really, basically argues that we've kind of not known throughout history what to do with persons who are suffering with mental illness. One remedy we tried, Foucault notes, was isolation. And you even see that in the scriptures. Jesus encounters the man who ultimately has legions of demons. The Bible says when Jesus finished, he was clothed and in his right mind, which is a biblical reference to some kind of state of mind that was being affected by a really demonic attack in the report of the gospel. But with that, my point is, he was kept out. He was in the graveyards outside of the city, and this whole kind of isolation. We don't know what to do with you, but just go on over there. If you've ever heard the term ship of fools, that has mental health history reference, as Foucault notes, that they used to just put them on the boats with sailors that were going, just take them on a cruise somewhere, put them in the gully of the ship and just let them go ahead. And the term ship of fools actually is a reference to what to do with these persons who are wrestling with mental illness. After that, interestingly enough, the church began to take on care with running what we would call perhaps, or what they called asylums, and those kinds of things were often managed by the church, the Catholic Church. So the church used to be very involved in mental health affairs. And now, then of course, later the state took them on. But we were talking about this case with Daniel Prude. And I say that to say, what do we do? And now police engage. And so there's some calling of 911. And Dr. Shepard, you were giving some valuable insight on that. What do we do? And what does the Daniel Prude case say to us?
Absolutely. There are so many Daniel Prudes that is without name recognition in this country, unfortunately. When a person is experiencing a mental health crisis, one of the first things we may think of, call 911, call the police. And that's what this family did. That's what the brother did. He called the police, and he was poorly clad, which means he didn't have too many clothes on. And he was walking down the street. And when the police found him, he actually was naked, and spent some minutes with the police. I think several minutes with the police. And then before we know it, they were performing some type of hold on him which caused him to pass out. So, this thing with the police, it is virulent. It's a it's a malignancy, unfortunately, how they're treating our Black men and women. I have to use that word. I use that word very strongly. I don't like to mince words. It is a malignancy. The police brutality against Blacks. It is spreading. And unfortunately, we are not made aware of this until video cameras and video footage comes out. And so, as a part of the American Psychiatric Association Black Caucus, we were in discussion just over the last 24, 36 hours. And we were saying that we should stop having people call 911 in the middle of a mental health crisis. That's huge, you all.
Wow.
The doctors, the psychiatrists, we're wrestling with whether or not does it make sense to call 911 anymore when someone is in the middle of a mental health crisis. Why? Because of what we're seeing. And it really is unfortunate because, back in the day, we didn't have the body cameras. So now that we have the body camera footage, and so many police departments are now required to wear them. And if they have the money, because there's certain departments who don't even have the cameras yet, even though it's supposed to be in place, they just don't have the funds yet to get them, or they haven't made those funds available. Let me say it like that. So we've been debating whether or not do we call 911 when someone's in the middle of a mental health crisis. So you might say, well, what do we do? You may want to call your spiritual leader. You may want to call a family member. You may want to call the crisis hotline of a community mental health organization that's in your neighborhood. There needs to be alternatives. That's what I'm saying to you all. And that's what we've been discussing. We have to have alternatives to just calling the police when someone is in a mental health crisis, because it is very clear. And I hate to say this, but it's just the truth. I'm now wearing this title, Chief Myth Buster. I don't necessarily like the title, but I'm going to wear it until we get ourselves together here. And I wear it, I don't want to say proudly, but I have no problem wearing that, Chief Myth Buster, because it is a shame that we are not able to call on the people who are here to serve and protect us. That's the slogan of the police when they're not able to do so. And again, I don't want to just blame the police, because many of them have not been trained. So if you have not been trained on how to be able to deal with a person in a mental health crisis, you're going to make errors. You're going to make mistakes. But that's why we have to get them trained. We can no longer just say it's okay that you passed the academy and you not have adequate training on how to deal with certain people. I'll say this one statement and then I'll hand it back over to you, Bishop. Mental illness is the only medical illness that we use the criminal justice system to respond to. I will say that again, and it's a shame. Mental illness is the only medical illness that we use the criminal justice system to respond to. Mental illness is a medical illness, and we use the criminal justice system to respond to it. What type of sense does that make? It doesn't. And which is why we're in the trouble that we're in now.
Powerful, insightful and powerful, Dr. Shepard. It's powerful on so many levels, and this is where the turbulence is. So, and this is why we're raising these, because if you want to use that, storms can cause turbulence, and storms is a confrontation of different fronts. And I see this confrontation happening here in several ways. One, there's the confrontation with Mr. Prude. There's racial tension, and then there's mental health tension. And so both of these are here. We were talking earlier this week to our audience. We were talking earlier about this, and we were just raising the issue of, is this an issue of police confronting a Black man, or is this an issue of police confronting someone wrestling with mental illness, or is it both? And is it combined? And are there prejudices and implicit biases on both ends. So it's like a double storm, intense turbulence. And then that's where the important piece of the treatment model, we talked about that, Dr. Shepard, a few weeks ago, these different models and perspectives. We were talking specifically about substance abuse, and there is some discussion of PCP use with Mr. Prude, and who had in fact been sent to the hospital before and released, and then ended up being sent back to the same hospital deceased. And so these discussions are all converging here. And so do you see mental illness? Again, as Dr. Shepard has clearly suggested, made clear, it's a health issue. But then you send someone who is only trained to really speak in terms of enforcement, which is behavioral. It is compliance and submission, dominance and submission and compliance and enforcement. That's behavioral issues to a cognitive concern. And so you see, and that raises the issue of the controversial discussion of police defunding. And this isn't an endorsement or a critique, it's the analysis of the issues that are here. Defunding might be a misleading title because it's suggesting should those monies be allocated to other things or maybe refunded to training, or as I see Minister Rhodes, Mia, has put there, another type of intervention besides law enforcement, which automatically implies that it's behavioral and that it is a criminal issue. Mm-hmm. And again, these mindsets, how do you treat this? If you think of it as a criminal issue, then you send the police and you do arrest and those kind of things. If you think of it as a medical issue, then the approach is different. And there's even a political element. So if you simply look at these things as on a platform of law and order, as our current administration does, White House administration, it's simply a law and order matter, then you may miss out on some of the other complexities. And maybe that's a gross simplification is what I hear you say, that it's more than law and order. Would you say that, Dr. Shepard?
Oh, absolutely. Absolutely. That's why it's best to go to a mental health professional, because and one who's been trained in how to deal with adults and children. Sometimes I can figure out quickly that whether or not this is a mental health issue or is a behavioral issue. And there's a difference. There is a difference. There's a clear difference between a behavioral issue and a mental health issue. All right. Behavioral issues are treated with behavioral management. There are some mental health issues that can use behavioral management issues, but it typically requires a form of therapy and medication management. And so we have to know that there is a difference. Let me tell you, Bishop and I, we actually got a chance to see each other as we were conferring and doing some business today. And even since I saw you, Bishop, I looked up, I got this message from the Washington Post. People now know I'm just reading. I'm just constantly reading. If I'm not doing anything, I'm just, my mind is just going. And I was just reading the Washington Post just in the last hour that they were doing a study on Black women. And I look forward to a show where we're going to be highlighting the Black women and the plight of the Black women. But the Black women make up 13% of this female population. Hear me on this. But 20% of the of those women, 13% of our female population are Black women. But when we look at the number of women who've been shot and killed, is 20% of those women are Black. So right there, we're out of order. And then 28% are unarmed deaths. These are just Black women. So you go from 13%, and then when you look at the number of women who are killed, 20% are Black. So that right out of order. Then of the unarmed deaths, 28% of them are Black women. Wow. That tells me that there is a bias. That's my point. There is a bias with Black women. Then Black men, it gets even worse. Black men, 12% of the U.S. male population. But of the men shot, 27% are Black men. That's double the percentage points. All right. And if anybody knows anything about math, that is huge. And then unarmed deaths, 36% of them are Black men. So we have got a issue. It's not just a mental health issue. It is a racial bigotry, injustice issue, and it is with Black people. Sometimes I use the word people of color, but I'm telling you, there's a boldness again this year. It's not just with all people of color people out there. It is with Black people. These are Black people. All the different ethnicities who are other than white cannot state these same statistics that I just gave. So let's not be unashamed. We should be horrified, but we need to speak truth to power, and that this is what is happening within our Black women and Black men. And we look to as future shows to be able to highlight what we can do for the Black woman, for the Black man, because we want to make sure that we are doing our due diligence and intervening on our behalf. I have the ability to talk with some folks, and I look forward to even this month to seeing how can I intervene and making sure that certain things are in place for the City of Baltimore Police Department. You can only do as much as what you're allowed to do, yes, but at least you're making an effort. And so that's what we have to recognize here. There is a strict bias. And so that's why we're having this conversation. Do we call 911? I'm going to go back to what I said. That's powerful, you all, because there's going to be some cases where I was like, you know what? I'm better off calling somebody else than the police. And I hate that we had to get to this point, but that's where we are.
Yes. And I know you will concur that the introspection is, and I mean societally, that the introspection is important, even though it's difficult, even though it touches on sensitive matters. It is still necessary. As long as we avoid the issue, we don't really address it. We don't really heal it. And so even what you said, sociologically, that's important. Those demographics matter. And the emphasis on the particular issue of Black people. That's why we're raising that. Here's the sociology of it. There is no other people of color are specifically listed and mentioned in the history of the United States constitutionally. Absolutely. So this unique ethnic group that is the African American, the North Atlantic, the Atlantic slave trade was from Africa to other countries. And so the African American has been a particular target in the American experience. It's part of the history and the ideology of who this nation is. And so that's why it's important to specify that it's not just all people of color. You could say that, but there is a particular kind of issue with stereotypes and treatments of the only ethnicity that is specified in terms of the 3/5 compromise and how do we count them, and let's subhumanize them. And there's a psychology of subhumanization that before you can really assault someone like that, you have to subhumanize them. It's Rene Girard's theory of mimetic desire for you nerds out there. But in order to assault someone and perpetrate violence against people like that, you have to anesthetize the conscience. And to anesthetize the conscience, you have to dehumanize them. And so all of these things are present in the collective psyche of the history of who this nation is. And that's why you hear the specific thing that Black Lives Matter, because all lives can't matter until Black Lives Matter. And we have to address this disproportionate treatment, that if I am going into these situations with implicit bias, how does that affect? And I have to make a decision in seconds, and I have rising anxiety because I'm aware of my own mortality, and I've seen images and heard stories that create negative stereotypes. How are all of these things influencing? And clearly they are if there's such a disproportionate use of extreme measures against not the people of color, but against Black people. And so that has to be addressed in order to bring it up. And denying it does not help. And denying it behind the patriotism, things that make us feel good. It's not anti-patriotic to raise these things. It's actually more patriotic, I would argue, because it's trying to say we could do better and we can be better if we deal with this. Dr. Shepard?
Absolutely. Because the other thing that they need to be trained on, and they being the police, is that you have to learn how to respond in the moment of crises. So I have a problem with the current president who stated that the police, when they shot Jacob Blake, that they choked. That was an insult to every Black American that is in existence right now. That was an insult. You can't choke when you're dealing with a crisis. This is not a golf game when you're attempting to shoot a 3-foot putt and you choke. This is my life, Do not compare my life to a golf game. In a golf game, you can go back and get another chance. You can't get another chance with another person's life. I don't care what denomination you come with. There is no reincarnation of you coming back. And all right, I'm gonna step on some toes right there, but I'm just telling you, this is your life that God gave you. You better live it to the best of your ability. All right, until that great day in the sky when we will meet Jesus again. So anyway, I won't go off track there, but I just, while you're here on earth, this is your chance. And we have to make sure that we make the most of it. And I'm not going to accept people who will allow the president to get by saying that. I let people know very clearly, well, he didn't mean it. Well, you know what? He should not have said it. He said it. And my life is worth more than someone kind of choking, and don't know what to do. That's why they need to be trained. That's my point. They have to be trained. When I am in the middle of a crisis, when a physician's in the middle of a crisis, let's put it that way. You don't need a physician in there with shaking hands in the middle of a surgery and something goes wrong and they're like, oh my God, they choke. No. They're going to kick you out. I've seen it happen. I've seen it as a student when something went wrong. They excused that doctor and said, you need to go get it together. And when you do get it together, you can come back into the operating room. We don't play. So how is it that the police are given that leeway and physicians are not given that leeway? We're dealing again with people's lives. And I'm just really kind of hearing that analogy now. We're both dealing with people's lives. So there is no play, no wiggle room. So yeah, I just had to put that in there. That upset me.
That's important. That's important for any of us who are caregivers, who provide services to others. That piece of training, sufficient training, any of us who take people's lives into our hands, if you will, to certain degrees as human agents, medical physicians. It also applies to police officers. It also applies to pastors. We're caregivers of the soul. We have an ethical imperative to be prepared and trained, and not just kind of winging it. So when we see that we have issues, we have to discover where those issues are, where we can serve better, and get the training for that. Now, as it concerns these matters in police, particularly, the training is a policy matter. That's a policy matter. We salute the police. There's something inherently noble about being the protector in society. In family therapy, these roles evolve. There's the hero, there's the mascot, there's the protector, and so usually these roles evolve. And in a societal level, police officers at their best are those who have a burden to be the protectors, to protect and defend, to serve and protect. It's a servant kind of context to it, and I'm willing to risk my life serving. And there's something noble inherently noble about that. Jesus said, greater love has no man than this, than to lay down his life for a friend. And so this idea of being a protector, we want to be clear that in ideal, it's a wonderful thing. And yet you have to be trained for it. And that's a policy matter because we are taking lives into our hands. And that does include being trained in the areas of mental health awareness. If, as many reports are saying, that mental health conditions are elevated, anxiety and depression and all those things that we may be encountering, then we have to be more aware. That's one of the reasons this Spirit in Mind Forum exists, is to say, hey, this stuff is out there and it's happening. And if we're going to serve others as the best version of ourselves, we have what is called an ethical imperative. It's just the right thing to do. It's absolutely necessary that we be trained to the best of our ability so that we can serve others to the best of our ability. And what I hear us say, Dr. Shepard, that we can learn from this situation with Mr. Prude is that we have a responsibility to be better trained in the area of mental health awareness and intervention.
Absolutely. Absolutely. And, I'll just add, this is a tidbit, with us having this platform that we do and keep it within the spiritual framework that we do, it is important that we as spiritual leaders talk about this. This is not a show where we just went divergent today. No, this is what the church is to be doing. This is right in line with the God-given purpose of the church for us to be able to handle the matters that the people of God face on a daily basis. And so just wanted to emphasize that, just bring some emphasis to that, because this is in step in line with the ministry that God has given unto us.
Absolutely. Absolutely. They're my cornerstones of ministerial approach. Reclaim, recognize, and refer. And so I think we have to do that. We have to reclaim our awareness of the church's responsibility as first responders often to emotional crises, mental health crises, and then recognize thresholds of referral, and when necessary, refer or collaborate with things that keep those in mind. They're my pillars. And I won't say any more because that's my next book. But but working on that right now. But listen, we want to be clear on what we're saying today, that what we can learn from these turbulent situations, particularly the most recent one with Mr. Prude, is that mental health factors are in here, and we have to be aware, and we have to be trained. And this is a complex matter, and to be trained, we have to own that, and we have to recognize that there's shortcomings in areas in which we need to improve. It's not a fluke. It's not a game. It's not a 3-foot golf putt. Life and death is at stake, and we are holding people's lives in our hands. The mayor, and we close, but even in Rochester, there's this turbulence between the mayor and the police officers, because the mayor said that this represents a failure on several levels. Mayor Lovely Warren, Rochester mayor, said that between the mental health community, the police officers, she said she was left in the dark. And so we got to collaborate. We got to find these solutions together to a complex issue. And we're going to ask you to join us next week for Spirit in Mind, because we're about out of time today. But Dr. Shepard, how do you want to close this out, sir?
I'll just tell people, continue to follow us, continue to look us up on our social media pages. People might say, well, man, he got a bow tie on today. What's going on? Well, as soon as I'm done with this, I'm headed to another engagement for the Church of God in Christ, General Council of Pastors and Elders. So if anybody out there is Cogent, you can join on that streaming platform that they have. That's already going on now. So I'm looking forward to joining them with the mental health moment over there. So that's why I got the bow tie on today. And who knows, I might pull it out again. But we want you to join us. We got some good surprises for you all coming up for the month of September. We are just kind of giving you all a little tease, but we're gonna take it another step higher. And I'm so grateful to God, Bishop, for what he is doing through this ministry. So please be safe and stay healthy.
Absolutely. Again, I want to echo that. Thank you for watching Spirit in Mind. Thank you for your support. Please tell somebody about it. We have some wonderful developments that are happening with this Spirit in Mind broadcast. We'll be announcing them in the month of September. And we look forward to seeing you next week on Spirit in Mind. God bless you.